YouTube viewers, very good evening. Today, I plan to just take few people to go into the abdominal cavity. We come across so many problems in abdomen. In one is that is abdominal pain. We don't know what reason it's coming, but we should have an idea. People should have an idea regarding the abdominal pain. So that's why when we can get some pain, we know due to what reason we are getting a pain. So for small briefing, I'll give some ideas about the abdominal pain now. Usually, the abdominal pain can occur along with other signs and symptoms such as nausea and vomiting. Occasionally, the episode of abdominal pain may relate to bacterial or viral infections like gastroenteritis or result from overeating or eating too much of wrong food like fatty or gas producing food, or people within tolerance to some sugars, milk and dairy products. Abdominal pains that's recurrent, persistent or severe may signal a variety of other conditions. Now we'll go with the abdominal wall pain, that is not inside the abdominal wall. Means it's not inside the abdominal cavity. It is in the abdominal wall. Like that, say it's a muscular pain. The pain is nagging type accompanied by the tenderness in the abdominal muscles. That means if you touch on the muscles, like there will be a tenderness. That means that is the pain. That increases when muscles are tensed. That means like if you do some movements like this, there will be a tensed pain you can feel, such as when it's sitting up from lying position, or like you're from lying position, you're like standing up, or like lying down, like standing position, you're lying down. You'll get that these pains, type of pains. That's whenever there is a muscular movements, you'll be getting that such a pain. So the specific spot, like there may be some spot you'll be having the pain, that's we call as a triggering point. That means the muscles in that place have gone for the constriction and strain. So that's how this triggering point can be located where the pain is worse with the abdominal muscle tension. So this is due to the abdominal wall pain. That means it's not inside the abdominal cavity, it's come from the abdominal wall. That like your walls of the rooms which we have the wall, like small walls like with the shingles and other things, something like that. We have the muscle layer which is covering the abdominal cavity. That cavity muscles having a tenderness or like that have the tension, strain, or like you are having a weight lifting something when you are doing, that time you will have that such a type of pains. Unaccustomed work when you are doing, or like some twisting work, that muscle can go for the strain, you will get a acute abdominal pain like some symptoms. Next, we'll come to the acute pancreatitis. What is pancreatitis? See, we have the pancreas inside our abdominal cavity. That's have the endocrine as well as exocrine like function. This is when there is an infection in pancreatitis, there you are going to get when there is an infection in pancreas, you are going to get a acute pancreatitis symptoms. When we will be getting a pancreatitis symptoms, like there are so many reasons to get a pancreatitis. Like I'll be talking each and every topic, like maybe like I will be covering now 9 topics. This is briefly because like each and every topic is a huge topic. We'll be covering afterwards with each and every signs and symptoms. Now, we have around 12 reasons to get acute abdominal pain. There is one is we already learned, like it's abdominal wall pain. Now we go to the acute pancreatitis. It's a mild to severe pain in upper abdominal or mid abdomen may radiate through the back. Reason for the acute abdominal pain around 12 types. In that one we learn is acute abdominal pain due to the anterior abdominal wall pain. Now we will go to the other topic, that is acute pancreatitis. Mild to severe pain in the upper abdomen or mid abdomen may be radiating through the back. The patient have the mid abdominal pain that will be radiating to the back. The pain may be persist for hours or day without relief and accompanied by the nausea and vomiting. The alcohol and food may increase the pain. Bending forward or curling up in the fetal position may relieve it. That is, the patient, when they get a pain of acute pancreatitis, patient is going to have the pain. How this patient is going to show you the pain? The patient will have the bending forward and curling up, standing like this. This is the acute pancreatitis when the patient will be having this position. So that may be relieving the pain. So the patient always stand on that position. That's the signs and of one patient who is having a pancreatitis. Third topic, that is appendicitis. More common when the patients are coming to the hospital. Always talking about the appendicitis. You should know the signs and symptoms often start with the loss of appetite. First symptom will be loss of appetite, low grade fever and nausea with or without vomiting. The pain is initially located around the umbilicus. Then it's later move on the right iliac fossa, that is lower right abdominal place, like that is right abdominal cavity. That means initially the pain around the umbilicus and that will be going shifted to the right lower abdomen. That is the in acute appendicitis you will be having these symptoms. Next we'll go to the diverticulitis. That pain typically come on suddenly, like you'll be sitting simply, suddenly there will be a pain accompanied by fever and nausea. The signs and symptoms are similar to those of appendicitis. Same like appendicitis, the pain will be there, except this pain is usually located in lower left abdomen instead of right lower right. The diverticulitis is a small bulge in the large intestine, which is maybe infected like appendix. It may be a diverticulum, that is a bulge in the large intestine. That's mostly present in the left side of the large, like that is the descending colon. So the pain typically comes on suddenly and accompanied by fever and nausea. The symptom may be looking like an acute appendicitis, similar to those of the appendicitis, except that pain is usually on the left side. Here, in appendicitis, it's on the right side, right lower quadrant. It's in a diverticulitis, it's on the left quadrant. Now, we'll come to the gallbladder attack. Where the gallbladder is stacked, it's right side upper abdomen. That is just it's inside the liver, the gallbladder will be there. So the pain is usually in the right upper abdomen, right mid abdomen, and may radiate to the back and right shoulder. So it is unrelieved by changing the position and taking an antacid or pain medication. Usually gastritis will reduce with the antacid, but the gallbladder pain won't reduce with the gastritis medicines. The pain is often occur 1 or 2 hours after eating. It may be associated with nausea or vomiting. Because why it's associated with eating? Whenever you are eating a fatty food, there will be a bile secretion. Whenever there is a bile secretion or gallbladder is going to function, you are going to get a pain. That's the reason. Whenever that's associated with the pain, after the pain 2 hours, if you are getting a pain, you should consider that also like in the upper quadrant, you should consider that is the pain is due to the gallbladder. Cholecystitis or like calculus cholecystitis, or like it may be the like stones on the common bile duct, whichever maybe it's feasible. Inflammatory bowel diseases. The pain is caused by inflammation of the intestine. It may be accompanied by cramping, diarrhea, weight loss, fatigue and intermittent fever. See, whenever there is a large intestine, that is the inflammatory bowel disease, mostly it's affect on the large intestine. Large intestine have the cecum, ascending colon, transverse colon, descending colon. If you are coming to see here, see like the diagram, just I can show here. This is the cecum, this is the ascending colon. So this is the small intestine, it will be here. So whenever there is an infection on this large intestine, that is called like gastroenteritis. So what we are coming to say, this will always have the diarrhea. Whenever there is a large intestine infection, there will be a diarrhea, weight loss, fatigue and intermittent fever. So this is called acute gastroenteritis.